The life of every Canadian was affected this year by the fight against the pandemic. For some, it was an inconvenience. For others, it was a roller coaster of anxiety. And for some families, nothing short of a devastating tragedy. CTV's Quebec Bureau Chief Genevieve Beauchemin with number 2 in our top 10 news stories of the year, the spread of COVID-19 in Canada.
The country was bracing for the first case on Canadian soil, and it came on January 25th. A man in his 50s who had returned from China was admitted to Toronto's Sunnybrook Hospital. Officials squeezed in side by side, an odd sight now, and delivered the news.
So we're here to announce our first presumptive positive case of novel coronavirus.
Canada's public health response kicked into gear, and by March, the once unthinkable began.
It's a bit spooky.
Strict lockdowns were imposed in many provinces. Schools were shut down, businesses closed. Learning and working from home became the daily routine for so many, turning big cities into ghost towns.
I have 2 kids. I'm a single mother. I don't really know what I'm going to do.
The country's public health officers became household names. Doctors Teresa Tam, Bonnie Henry, Dina Henshaw. Terms like distancing, modeling, and flattening the curve snuck into casual conversation, and masks became must-have accessories. Still, the virus marched on.
From the top of my head, pretty much right down to the bottom of my back, it feels like a million needles just stabbing me.
Among those infected, Sophie Grégoire Trudeau, who had traveled to London. Prime Minister Justin Trudeau self-isolated, working from his home, Rideau Cottage.
I have no symptoms, and I'm feeling good.
COVID's first casualty in Canada was a man in his 80s living in British Columbia.
One of the residents of the Lynn Valley Care Home who was infected with COVID-19 passed away last night.
This one's for you, Pop.
Ground zero quickly became long-term care homes. That's where 3/4 of the deaths have occurred.
He had 4 little cups of ice cream, went to sleep, didn't wake up. He went exactly how he wanted to go.
Quebec's long-term care homes took the biggest hit.
We lost a lot of people. I got sick too.
Chronic staff shortages and critically low supplies of personal protective equipment fueled the killer spread, and the consequences were devastating. Canadian Armed Forces personnel were called in as reinforcements, but after their humanitarian mission in Ontario, they reported shocking and disturbing conditions in 5 long-term care homes. Rotten food, cockroach infestations, disregard for basic cleanliness. There was a loosening of measures over the summer months and back to school for some students in September.
I'm excited so much.
The second wave brought a return to confinement, closed doors and bans on gatherings.
Freedom is essential!
And resistance to restrictions grew louder. Some flouted the rules, held parties. There were protests, some in malls, and police tried to crack down. This as governments repeated the message that it was crucial to save lives and to protect those serving on the front lines. The essential workers, those in pharmacies and grocery stores, and those working to exhaustion in homes and hospitals. They are heroes of the pandemic. Vials of vaccine did land on Canadian soil in December, earlier than first imagined, bringing along an injection of hope. Still, as the rollout of the vaccine continues, the immeasurable impact of COVID-19 that has transformed the lives of Canadians will stretch well into 2021 and likely beyond. Genevieve Beauchemin, CTV News, Montreal.